This segment is sponsored by VCU Health.
The doctor is in and you have questions today. We're joined by Dr. Emily Godbout, an epidemiologist and infectious disease specialist at Children's Hospital of Richmond at VCU. Dr. Godbout is also a mother of two. She's acutely aware of the impact of COVID-19 on kids and families. She's ready to discuss what the COVID-19 vaccine is all about and what parents should know. We welcome you, Dr. Godbout.
Thank you so much for having me.
It's our pleasure. This really is incredible. Of course, the vaccine is already in the phase rolling out, and then essential workers and seniors could be next. Why is it so important to have the COVID-19 vaccine available and put this behind us?
So vaccines have a long-standing history of working. This is why we don't see infections in our country anymore, such as polio. The mRNA COVID-19 vaccines are not only safe, but they are 95% effective at preventing disease. So it's very, very important that we get the mRNA COVID-19 vaccines. The goal is so that the vaccine can show our immune system how to fight the virus. And it's important to remember that the vaccine doesn't contain live virus. Sometimes after we get the vaccine, we might have a little bit of pain at that vaccine site, a little bit of muscle aches, and some people develop fever, but that is all normal. That is part of our immune system working. I was so grateful and humbled to have received the COVID-19 vaccine here at VCU, and I really had very little side effects.
It's been incredibly encouraging to see the vaccine being rolled out as it is, essential workers, healthcare workers receiving that and learning what that's all about. When will we learn more, and why is the vaccine not necessarily available yet for children?
So as of right now, the COVID-19 vaccines have not been fully studied in children. The Pfizer vaccine is available for children aged 16 and up, while the Moderna vaccine is available for those who are 18 and up. Our children have different immune systems, and their immune systems vary at different ages. So it's important for us to make sure that we study the vaccine so that we know that it is safe and effective for children. Right now, there are clinical trials going on around the country for children as young as 12 years of age. And then we anticipate trials in the future for even younger children. So the bottom line is we're going to have that data, and we believe they'll be safe and effective, but we really need to wait until we have the research and science to say that.
As we mentioned, you're a mother of two. I'm also a mother of two. What advice are you sharing for what families should do until there is a vaccine for children?
So the biggest thing right now is that we need to keep up with all those good infection prevention strategies that we've been practicing throughout the COVID-19 pandemic. This means wearing our masks while we're in public for those ages 2 and up, making sure we're washing our hands frequently. If you have young children, I always have a bottle of hand sanitizer with me when we're on the go. Making sure we're not gathering with lots of people, and making sure we're trying to maintain our social distancing, especially around those who aren't part of our home. And then when it's, for our parents and our grandparents, when it's your turn to get the vaccine, I highly encourage you to get the vaccine, because you'll not only be protecting yourself, but you'll be protecting your children and your community as well. It's really important that we continue all these infection prevention strategies, and we can't really talk about stopping them until we reach herd immunity in our communities.
Absolutely. So many things have changed. So many things have evolved. But are there continuing things that you would like our viewers watching today to know?
So it's been a very challenging year, and I know that a lot of people are really tired. But it is important to remain vigilant. And as you mentioned earlier, I'm a mom of two, so I'm aware of the challenges that this poses, especially if you have children. We've had to adapt our daily lives. We've had to change how we socialize with people, how our children learn, and how our children play. But again, it's so important to continue our infection prevention strategies to really keep ourselves safe, to keep our families safe. I also like to remind our parents that it's still important for your children to come in for their routine vaccinations. And then if your child is sick, we are ready to see you in our hospital, in our emergency room. It is safe, and we are ready to take care of you and your family if you need us.
Absolutely. Those resources remain readily available. Dr. Emily Godbout, thank you so much for making time.
Thank you so much for having me.
It is our pleasure. For more information, you can learn more by visiting chrichmond.org/COVID-19. You'll also find the Children's Hospital of Richmond at VCU on Facebook, Instagram, and Twitter at Children's at VCU. Stay with us. There's still much more Virginia This Morning to come.